Diseases and disorders of the nervous system can be quite complicated. They generally start within the brain and the spinal cord. And so here in this slide, we have different types of paralysis. So you have paraplegia, quadriplegia, hemiplegia, and monoplegia. And what you can see here in the picture is the different areas that are affected. So paraplegia, paralysis of the legs; quadriplegia, paralysis of the arms and the legs; hemi is going to be half of the body; and mono affects just one limb. So 4 different types of paralysis here, all caused by spinal cord injuries. You have neuralgia. Algia means pain. Neuro is nerve, so neuralgia would be nerve pain. We also have what's called ALS, or Lou Gehrig's disease. And with Lou Gehrig's disease, you can see here with your healthy motor neuron compared to one that has been affected with ALS. Remember, in our healthy neurons, they have the ability to communicate with others. Cell to cell, they create movement, they create sensation. And when that is affected, which you can see here in the damaged motor neuron, there won't be the ability to communicate throughout the dendrites because they're affected. And so this is a fatal disorder. It is degenerative. It can occur over a long period of time. It varies patient to patient, but it starts with having healthy neurons that then become affected and they lose the ability to communicate with others. And that can cause what you see here in the photo, paralysis, and then eventually leads to, unfortunately, can lead to death. Meningitis, also known as kissing disease, very common within the youth, the teenagers. It's an inflammation or infection of the lining of the brain and the spinal cord. Parkinson's disease, something that we're still learning a lot about. It is progressive, degenerative, so it can take a period of time to affect the system, but it does eventually affect the motor system. And what it does is it causes uncontrollable tremors or shakes. TIA, transient ischemic attack, otherwise known as a stroke, starts with what's called a mini stroke, and that mini stroke we refer to as a warning sign. Typically, when someone has the signs or symptoms of a mini stroke, it's letting us know what may be to come. And so it's important when someone does experience these types of disorders that they seek treatment immediately. We want to be able to get ahead of problems that could arise in the future. Bell's palsy is what you see in the photograph here. And Bell's palsy, also part of the nervous system, can be caused by various reasons. It's also linked to pregnancy, stress, causes weak or paralyzed facial muscles, and it's temporary. So as long as that stress is a factor, we typically see the Bell's palsy occur. Once that stress is reduced, so is the paralysis within the face. Epilepsy, these are seizures. The body has its own electrical conductivity that's happening within the cardiovascular system. Also, there's electrical conductivity happening within the brain. And so seizures result from bursts of electrical signals in the brain. It's just a whole mess of signals that are happening at once, and the brain can't take in what's happening. And so it seizes is what happens. Stroke, last term there, otherwise known as CVA. A blood vessel in the brain is either blocked by a clot or burst, and brain damage can occur due to the lack of blood flow. Strokes do restrict the amount of blood that is flowing through to the brain. And so if this is not treated very, very quickly, this could be extremely detrimental. And CVA, cerebrovascular accident. Headaches, part of diseases and disorders associated with the nervous system. Different types of headaches we see patients experience. We have migraines, which is the most common, and migraines are classified by their symptoms. Their symptoms are different from your typical headache. So with migraines, we see nausea, vomiting, light sensitivity, whereas cluster headaches are just that. They're a severe form of migraines that occurs in groups, so one after the other. And then tension. Tension can be chronic over a period of time or episodic, dealing with stress that's happening right now in this moment can cause a tension headache. Very last disorder there is called Guillain-Barré syndrome, and this is an autoimmune disease that attacks the peripheral nervous system over time. And when you hear the term autoimmune, that means that the body is fighting its own healthy cells.